Welcome to the COVID-19 September 14 of Phu Bao Gia. Today there is a remarkable news as follows. Hurricane Cytokine attacks many HCM city patients. Invite you to follow. Ho Chi Minh City, 70% of patients treated in the Center of Positive COVID-19 Sickness, Panic Hospital No. 16, attached to Bach Mai Hospital, encountered cytokine storms, and mainly young people. Storm cytokine is a typical symptom of the patient in this epidemic that the treatment doctors face. Dr. Du Ngoc Sun, Deputy Head of Emergency Department, Bach Mai Hospital, in charge of the Center for Positive COVID-19 Persons in the Padang Hospital No. 16, said normally, healthy people are attacked by the virus. The immune system will react. The body releases cytokine to inhibit the virus. However, some people secretly produce cytokine, affecting viscera. Why does the immune system react too much? Do not explain yet. This phenomenon of medicine is called cytokine liberation syndrome, or cytokine storm. According to Dr. Sun, 70% of COVID-19 patients treated at ICU are in charge of Bach Mai Hospital, with cytokine syndrome, occurring at all age but mainly young people. The doctor received the treatment of patients 17 years of age or 22 years of cytokine storm, causing the body to collapse quickly. Many cases don't get a pass. How much young patients, when you meet cytokine, the more ways, follow Dr. Sun. More than 50% of patients transferred to ICU Bach Mai need to support the breathing, high-flow oxygen breathing, many other resuscitation measures. This is a group of heavy and critical patients. Compared to the previous epidemic, the number of patients increased much, dragging the number of heavy cases also increased. Heavy patients with basic symptoms such as respiratory failure need immediate respiratory support, in addition to manifest in the heart, kidney damage or other agencies. The main mechanism is a direct or indirect virus that causes these agencies to lack oxygen to lead to injury. Determination of cytokine storm control is one of the optimal measures to help patients more severely rescued opportunities. ICU Bach Mai conducted early diagnostic tests for 100% of patients into the center, to diagnose early detection and early treatment, cytokine storm. Test results helps to diagnose what patients encounter, storm cytokine, don't. If cytokine is at any extent, from which doctors actively regimen early treatment, minimize mortality, Dr. Sun said this is the difference of Dr. Sun emphasized. In terms of treatment, there are many measures that are basically maintaining life during stormy cytokine such as mass breathing, carrying enough transmission, medication, in addition to absorbing hemodialysis, using monoclonal antibodies. This regimen to reduce the risk, toxic factor that the storm, cytokine storm, usually appears in the first week and the second week of the disease. If the patient is treated, lucky escaping, it can recover after about 2 weeks of treatment. ICU Bach Mai is synthesizing the report on efficiency when testing and treating early cytokine storms for COVID-19 patients. Currently, other hospitals have no specific data. However, according to Dr. Sun, the basic treatment regimen is effective. There are many patients who avoid this storm and recover. In 2020, the status of storm cytokine occurs to British pilot patients. Patient 91, 43 years old, weighs 100 kilograms. The lungs are almost completely, coagulation disorders, ECMO intervention, is the heaviest shift in Vietnam in the first epidemic. At that time, COVID was new. The treatment regimen was also being treated by a doctor who had just been treated and updated and lacked only symptomatic treatment. The Ministry of Health had to enter anticoagulants from abroad to treat blood coagulation for patients 91, taking into account the pneumocundent. Thank you for watching all the program. Looking forward to you. Please like and register for support channels. My dear, and see you again.